Hi everyone, I'm Ashley with 9 Health, and this is Health Happens, our weekly Facebook Live show. And with Health Happens, we want to talk to you about giving you the information that you need to make the right choices when it comes to your health. So today, we're actually talking about something that is all the rage. With New Year's resolutions, a big topic, everyone or most people are probably thinking about losing weight. And a lot of times it's more than just having your pants fit right. It comes to be a big matter of your health and wellness. So today we have joining us Kimberly Penny, our co-director of health and wellness at 9 Health, and we also have Angela as our health coach. So thank you for joining us, ladies.
Thanks for having us.
We're a little cold here in the Health Happens studio today, so we're bundled up nice and cozy to be warm. But first, let's just kind of talk about the facts here, Kimberly. Obesity is pretty prevalent in American adults. Can you talk to us about that?
Yeah, it's quite startling actually. 1 in every 3 people suffer from obesity.
And that's adults, right?
And that's adults, and that's really scary.
It is scary. And it's not only, like I mentioned before, being overweight is sometimes a lot more than just looking good or feeling good, but it can be costly.
It can be very costly. You will have to go to doctor's appointments, pay co-pays, deductibles. Perhaps you don't have insurance. Annually, I think they say it's about an additional $1,500 that you will have to pay if you are experiencing something related to obesity.
It's a pretty big cost. And so not only is it more costly, but it's also can be deadly having obesity.
Absolutely. It affects your heart, your cardiovascular system, your vascular system, all of your joints. It can lead to type 2 diabetes, which can lead to amputations, dialysis, and many other things. You may have to have surgeries, knee replacements, and it's a real expensive thing overall for your health and for your wallet.
So obesity does go beyond just the vanity side of it, of feeling good and looking good. So talk to us a little bit about, there are some groups that are more likely to be obese than others, is that right?
Yes. For instance, I'm over 40.
No!
So, yes, I know, shocker. And I am more likely to obese because once you start aging, aging just, it gets you in many ways.
Sure does.
And also if you are African American or of Hispanic descent, and sometimes even family history.
So those are things you can't control, right? So what are the things that you can control when it comes to maintaining a healthy weight?
So you can start by taking care of your body and what you put in it and what you fuel your body with. You also want to have exercise incorporated in there. It doesn't mean you have to go out and run a marathon, but talk to your provider, get started on that, and make it simple. It can be something as starting out with a 15-minute walk every day and building up to the activity that you can sustain, and have a conversation with someone that's a little more difficult while you're having that walk. So Ashley and I might be like huffing and puffing a little bit while we're having that walk, getting our heart rates up. Also getting enough sleep, and this all helps your emotional mood as well.
Absolutely.
Mental health is just as important, and it plays a factor into the obesity.
Absolutely. So if you had to say if there's one thing that's more important than the other, can you say that? Is diet more important or exercise more important when it comes to maintaining a healthy weight?
That's a tough one. I think if you fuel your body with the proper things, you'll want to exercise more. You'll have more energy. Sugar actually causes us to have highs and lows, and you think, oh, I need all this energy. You may see children drinking Mountain Dew early in the morning, hopefully not, or even an adult, and they're getting all that energy, and all of a sudden their sugar level crashes, and then they're reaching for more sugar, and sugar is the enemy. And you probably won't have a great workout even if you do work out.
Right. You're going to feel good for a second, but you're not going to feel good for forever.
But if you had to concentrate on diet or exercise, you want to concentrate on diet first.
Diet's most important. Or not most important.
Both of them are
if you had to choose.
If you had to
choose.
choose.
You had to choose.
Yes.
So we did talk about obesity being a leading cause for a lot of major health issues, one of those being type 2 diabetes. So let's talk about that for a minute. Type 2 diabetes is something that can be prevented or reversed. Is that right?
Correct. Yep.
Okay. So it sounds like making healthy choices just has good benefits overall. So, luckily, it sounds like sometimes it can be so complicated. Where do you even start? But that's where 9 Health comes in. We actually have a really exciting new tool called ePrevent, and it's a digital tool that you can use on your smartphone, and it actually works to prevent or reverse prediabetes, right? So Angela, can you talk to us a little bit about that?
Yeah,
take it away.
Yeah, ePrevent is an app, so it's on your smartphone, and we don't have a smartphone with us, do we? And
all the smartphones are being used for the, for the technology.
So
here.
it's on your smartphone, and it takes 1 to 2 minutes each day, and you can enter. There's some passive data that comes in, like steps and your activity, and your sleep comes in passively, and then actively it takes about 1 to 2 minutes to enter your weight each day, your meals each day. It's not a calorie counter, and
Thank goodness.
your mood. And your mood is captured with emojis, so it's just easy, you know, how you're feeling each day to keep you mindful about how you're feeling affects what you put in your body and how much you exercise.
It's a really great app. I'm
And-
actually doing it, so
Yeah, and there's a health coach on the back end, like
just
me,
gonna ask you,
or
yeah.
somebody like me. So they are monitoring each of their clients, their inputs, and there are also passive data that comes in, and then giving them micro motivational and micro educational pieces of content to help them make different choices. And those little choices and little changes add up to big sustainable changes over time.
They
So that's
do.
probably what makes Nine Health ePrevent so different than these other health apps out there, is that you do get that personal touch of a health coach. One coach is assigned to you, right? So
Yeah,
you get to have
it's your coach.
that personal interaction. It's not just, you know, kind of like blanket statements sent to you. It's personalized based on what you've put into the app, right?
Or what your goals are, and and that, you know, each individual struggles. So the health coach knows that, and then can give personalized information and help in those areas. And it's also encouragement. Having that accountability and encouragement is really important
Absolutely.
to success.
the one thing that I like is at the end of the week I get a summary of how I did, and that's very helpful for me. I can see where I need to improve and where I did well, and it just motivates you again. And first thing in the morning I get a reminder on my Garmin, Kimberly, have you logged your weight today? And it's like, oh, I gotta get up, I gotta log my weight.
You gotta get up, gotta get moving.
And also each day at 1 o'clock, each client gets a text message with something regarding activity or weight, or something about meals and food, or their mood and stress, how to lower stress, or how to get a better night's sleep. So each day at 1, there's you know, a text message that comes through that's short, and it's just easy to read, easy to implement.
And the way that this works too is that this program is actually aligned with the Center for Disease Control Diabetes Prevention Program, right?
Yep.
So it
Yep.
is pretty proven to be effective.
Right.
Very much so.
And what's the success rate of people that use this program?
So 67% is the success rate, and the goal is when you start the program, the CDC's guidelines are 5 to 7% of your body weight, and so people that engage in the platform, that isn't hard to hit at all.
Just
Oh,
for
we
making
didn't
those
mention
small
hydration too.
Oh,
How important
hydration, yes.
is.
I had my
Very
coffee
important.
here.
Is that what you're counting hydration?
No, I have my water. I have my water too. I
You
have
do
my
have
water too.
Very good. So, you know, what I like about this tool too is that you're not counting calories, right? You're learning to assign kind of like feelings about the food, right? Instead of trying to hit a number every day, you're just learning to think the right way about certain foods. Would you say
Right.
that's
Right. So it's a food journal. You enter your food in, what you have for breakfast, lunch, and dinner, and snacks as well. And then it's just bringing mindfulness to that. So the app is asking you how you feel about it. How much did you eat? Is it an appropriate amount? Can you do better next time? Or this was a great entry, and also the time, because eating at the same time every day is important as well. I mean, not
interesting.
down to the minute, but that's also very important.
routine is good?
Right.
huh?
Routine is
That's
good.
awesome.
Same thing for sleep. Getting enough sleep.
Right.
Routine is good.
That's really cool. So I already asked you that. So, okay, well, how can someone sign up for this program?
I'll let you take
Well, it's very easy to do. Let me get my laptop. You basically go to our 9 Health Fair website. I can't really see right now.
that, which is
www.9healthfair.org, and you will click on. Is it eTools right there?
Do you like this demo?
I can't really see.
I can't see it either. I'm
Yep,
trying to
eTools
get
Yeah,
is
eTools.
in the right-hand corner.
Okay, Ashley will click.
eTools. And voila.
And voila, that's it.
You can even take a really cool risk assessment here too, which is entertaining but also very educational.
Yep.
The CDC put it out, and it's funny, and it shows the seriousness of this, because you do want to prevent type 2 diabetes. You do not want to go down that road.
So you just need a smartphone to do these eTools applications, and ePrevent is under eTools. So you just need a smartphone, and then we can integrate, the app can integrate with a Fitbit or a Garmin if you have one of those, or if you are interested in purchasing that. But that is not
It's not necessary.
Yeah, not necessary.
Okay, cool. And then I was going to ask you something else. You guys keep saying such good things, and I lose my train of thought.
That's what we do.
So I'm really enjoying all of your input. When I think of it, I will text you guys, I guess. No, we'll never do that. But okay, so getting to a healthy weight is so important, and this is something that can help you do that. I'm just remembering now. ePrevent. It's a program. How long is this program?
1 year.
1 year. Okay, so when you're signing up, you're committing to a year.
You're committing to a year.
Okay,
Yes.
excellent. And that's what it takes to kind of form those good habits and get into those life.
The nice thing about having your smartphone, it takes 1 to 2 minutes to enter your metrics each day.
Literally.
And then you have access to a health coach on the back end that's looking at where your weight is trending, and it has graphs on your sleep and your weight.
Don't
and all
look at
your
mine
mood.
today, Coach.
Right. So
That's awesome.
And
So-
it is really easy to log in and put that in. And I am a creature of habit and eat oatmeal every morning. And I'll start with oatmeal and then I'll say peanut butter, banana, da 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 da. So it learns to just automatically put in what you eat if
populate
you
it.
eat the same thing like I do.
And then it's also nice too to have that coach looking over your shoulder, so that if you're eating, Cheetos for breakfast and you're like, I feel great about this, they
Right.
can actually say, okay, well maybe not.
maybe we should choose something else.
Yeah, and do that behavior modification.
And the important thing about your weight loss journey is there's a lot of different ways to lose weight. So if there's one specific thing that doesn't work in your life, you can say there's a lot of other things that you can try. Obviously, soda's a big one. Alcohol can be a big one. It can add a lot of calories. But again, it's not calorie counting. It's just bringing mindfulness to what you're eating, how much you weigh. People that weigh themselves daily on average lose 6.6 pounds more than people that don't.
Oh wow.
So hydration is big for your metabolism. So just picking an area, a goal, and then your coach is there to help with accountability and also just support and encouragement.
Another thing that I find is, can you hand me my new water bottle?
Absolutely.
This is the way I get myself to drink water. Otherwise, I will not go fill a glass or drink out of an open container, and I take this everywhere with me
On the go.
on the go, because that way I realize exactly how much water I'm getting.
So overall, this sounds like a pretty effective program to create sustainable changes. So like we talked about, it's not a quick fix. It's not a fad. This is something that's going to help you for the rest of your life, because
It's a journey.
Yeah,
It's
exactly.
changing your habits, figuring
Exactly.
out if it's into your life, making just small steps that add up to big changes.
And so if you feel like you might be at risk for type 2 diabetes, you can go to our website, 9healthfair.org, click on eTools, and you can take that risk assessment. If it turns out that ePrevent maybe isn't the program for you, we also have just a general wellness app called eWell with the same kind of idea behind it, but just not as focused on that CDC program, the
Yep.
diabetes prevention. But either way, we're here for you. We want you to have the tools that you need to be as healthy as you can. So check that out, 9healthfair.org/etools. So thank you, Kimberly
Thank
and
you.
Angela,
Thanks
for
for
joining
having
us.
us.
If you have
It
any
was fun.
questions, feel free to post them in the comments. We'll definitely get back to you. And make sure that you join us next week on Health Happens, same time, same place. We're going to be checking in with a lifestyle coach on mindfulness, and check in on those New Year's resolutions and see how they're going for you. So thanks for joining us, and have a great day.
Thank
you.